In health and social care, there are three components. In component one, you learn all about the life stages, which there are 6 of them, and also about pies. Not the ones you eat, but physical, intellectual, emotional, and social, and all the factors that help with growing and that can hinder the development. We also do about a baby stimulation, which is to do with early childhood, which is programmed to cry, and you have to do putting keys to feed it, and you generally get an experience of what it's like to be a new parent and all about the positives and the negatives. We also, for Leah Adulthood, went to a care home with people with dementia, so you can get an understanding of the environment that they have to live in and what do they struggle with in a general life and how lucky some people actually are. And we also went to a preschool to learn about nursery children and what environment they also live in.
We've also got component 2, and in component 2 we learn about the services and health careers, and this gives us a basic understanding of what we can do after this course. So if we do well in this course, we get our level 2 in health and social care, and then we can go on to take our level 3 in college, and this opens up a huge, it's massive, the amount of careers that you can go into after that. You can be doctors, and you can go into nursing homes, and you can even be a private doctor and get paid quite a lot of money, which is always good. And we also learn about certain health conditions and how that may affect people using pies. And then we also got the opportunity to go around the school in the wheelchair. And so this showed us the barriers around Westfield Academy site. And it gives us understanding of how certain people with disabilities may have trouble getting around, and it gives us an extra bit of empathy towards those people with those different conditions. We also got to meet Miss Blackwell's granddad, who has a guide dog, and that was good because it gave us a great understanding of his needs and how blindness can affect people. And that was really interesting talking to him, and yeah. That was pretty good.
Yeah. We also have one final component, which is component 3, where you do all about organs and actually get to draw on t-shirts, so you can get an understanding of different conditions and diseases that happen around the body and which organs coordinate with them. You also get to learn how to take your temperature, blood pressure, your BP, and we also do an online test where we can become first aiders into learning CPR, which we practice on the dummies, blowing them up and really pressing down, and all about BMI, where is body mass index, where you actually have to learn which is healthy, which is non-healthy, if you are willing to go into a career during health.
We also learn in component 3 about care plans. For example, towards Christmas, we got to watch The Grinch and make a care plan for him. And this gives us a good understanding of if we went into a career in health and social care and we had to make a care plan for somebody, we'd have to take their needs into consideration, whether that be their physical, intellectual, emotional, or social needs.
And then during the whole entire time in the 2 years of doing health and social care, you'll complete 2 PSAs, which each have 5 tasks relating to what you learn about in component 1 and component 2. And then for component 3 is your final May exam, where you learn about the organs and the BMI, which is going to be at the start of May, and is going to give you your final grade towards health and social care.
Yeah. Thank you very much for watching, and I hope you take the course.
It's very fun.
Very fun.
You get cake sometimes this week.
Yes. Yeah. Well,